Yeah, great. So I'm Nick Kemp. I was trained as a social worker. I moved into social work management, and after trying to make the system work for a large number of years, quite frankly, I'd come to the end of the road, partly due to cuts, trying to make ever more happen with ever less. So I took the opportunity of early retirement to do other things. And then COVID struck. And what I could see happening, and I remember Nicola Sturgeon getting up in the Scottish Parliament and saying the care home sector would have to be responsible for looking after people in care homes. And everything I knew about that sector, I knew it wasn't going to happen, right? And as a result of that, I wrote something called A Predictable Crisis about it. In fact, I was going to do a blog for the Common Weal, but they actually came back and said, could you turn this into a proper paper? So I sat down for a few weeks, produced a paper about the history of the care home sector and why we'd led up to the disaster that happened just over 2 years ago with so many people dying in care homes. And then after that, Common Weal asked me to convene a group to look at care called the Care Reform Group. So we called it the Care Reform Group, and that got together in about November 2020, and we spent the next year and a quarter, once a week, talking about care and increasingly what we would like to see from a national care service. So that Caring for All was a product of that work, but we've also produced a whole lot of other papers. They're available on the Common Weal, has a sort of care section on their website, and you can read it all there. I'm not going to, what I would encourage everyone to do, if they've got the time and so on, is to have a look at the documents. The Caring for All is quite long because care is extremely complicated. We've tried to set out an alternative vision for the system. I can't in 10 minutes summarize 70 pages, but there are short versions available for people who want to have a look. So I think just in terms of introducing this, I think that where we've started from, and the most important thing is about what is care. And that's something that the Scottish Government so far hasn't answered, I don't think. So we're designing a care service without actually saying what care is. Care is integral to all of our lives. We would never develop as children into adults without having some sort of care. Sometimes it's not good enough, but without having care, we wouldn't develop as human beings. We're a species, we're very interconnected species. We're reliant on each other for a whole lot of things. And that's really what care is about. What I would say partly about this is all of us actually have lived experience of care. That doesn't mean to say that we have lived experience of the care system as it is, but we all have lived experience of care, and basically care and a national care service is a citizen's issue, just like the creation of the NHS was back in the 1940s, post-war. And in our view, it should be seen as a key part of the welfare state. And I think you'll all know at the moment, the welfare state is in massive crisis, right? It is close to collapse in many places. The NHS is under pressure as never before, but actually we think we need to put the wider welfare state onto the agenda, and everything to do with food banks, homeless on the street, all of those things, the complete failure and disintegration of the welfare state. But we need to put those things back together again if care is to work. And what's really important in terms of a wider approach to care is that we think that, income, housing, adequate housing, housing suitable for people with disabilities, all of those things are absolutely essential preconditions for making a care system work. So we can't talk about a national care service without talking about the wider welfare state. And you might, within some of the debates that are going on at the moment, for example, even look at, legal aid was part of the welfare state, that's been cut. Try and get legal aid to support redress against anything in the care system and you can't get it. So the whole thing is completely interconnected, and we need to see a care service, in our view, about a sort of rethinking of the welfare state in Scotland and a reinvigoration of it. Okay. What I just coming on and tried to keep it very simple, we think that the primary purpose of the National Care Service should be to provide care to people who need it, and it should be based on need. And in fact, some of the legislation in Scotland was exactly right. The 1968 Act created a duty on local authorities to assess need. That was completely right, but what it never did, what that Act never did, was it never gave the local authorities the resources to meet those needs. So what we've had, and of course we know what then happened with Thatcherism and so on, is that actually we started getting outsourcing. Local authorities had extremely restricted resources, and as a result of that, we basically had 20 years of 25, 30 years of cuts, reductions in care for something that was never properly resourced to begin with. So we've got an absolutely enormous resource challenge, and that has to be acknowledged. But I think what we would say is that absolutely care needs to be based on who needs it, and if you have that, you solve a lot of issues. So, for example, I mean, the government at the moment is talking about a right to respite. If you think about it, in limited circumstances, if carers, if the people who unpaid carers are looking after had a right to care when they needed it, if their unpaid carer goes off, it doesn't matter, they have a right to care. Instead of the carer being forced to provide care because what they're worrying, actually the person who needs care has the right to it. You solve all those pressures on carers in an instance. And actually we know what's happening at the moment. More and more of the burden of care is being put onto unpaid people, and it's with absolutely disastrous consequences. So, but there's a second, I think, purpose of a national care service, which I'd just like to flag up, which is that we've created an idea that we would call public care. Now, people have heard of public health, but what public care is about actually, because as I said, care permeates every aspect of our lives. You know, it's about having caring employers. It's not just about people who might care for you if you've got particular care needs. It's about caring employers. It's about having a caring society more generally. So a lot of other government policies, I explained, impact on people's ability to care. What public care would do would be to highlight all those issues and what else needs to change to make a care system work. And one of the problems at the moment, and to give health people credit, public health has moved into a lot of things that are really just care issues. So, for example, they've moved into loneliness, right? And what we're happening is we're medicalizing a lot of these issues. We're turning them into health issues, whereas actually loneliness is ultimately, it's just about our connections with other people. It's about us having places, contact, about having the social infrastructure where we can meet each other. So we need to be rethinking a lot of things, stop seeing them as being health issues, and primarily see them as being about care. I was going to highlight then for you just, and maybe I'll just pick up two issues. I've got a list of key issues, but I'd just like to highlight a couple. One is the rights approach. Now, the Scottish Government talks a lot about a rights approach, and for the last 25 years, the whole of social work policy has been permeated by rights. You know, so if you look at care standards, when they created the Care Commission, first of all, it was all about people's rights, respecting people's rights for this. And it absolutely hasn't worked, and it completely failed during the, rights during the COVID crisis were shown to be absolutely meaningless. I mean, I'm very pleased to see Jim here. I've read about his blog about him being left, how he was left during the Jim, how you were left during the crisis in your, I mean, it's absolutely disgraceful. But there were also all those people discharged to care homes and so on against their wills and so on. Rights were completely and utterly trampled over. And what we have to say is that there was a reason for that, is that they weren't real rights at all. But for a right to be a right, it has to be enforceable against the state. Right? So there actually has to be a thing where it's concrete. A rights approach is no good, right? You need concrete rights where if you haven't got those rights, you can take action and seek redress. We would say that therefore that rights need to be seen within a framework of responsibilities. So there's the responsibilities of the state to meet needs. Without those responsibilities, it's not going to work. And then you need, if the state's going to fulfill its responsibilities, there need to be the proper resources to do that, because it's no use telling local authorities or indeed integrated joint boards to do things, right, if actually they haven't got the resources to do it. So we need to see the whole of this, the rights thing, in a much wider framework. So we're very, very critical of the rights approach. And actually, I just was talking last week to Sally Witcher, which very interesting, who has just resigned, actually precisely because she thinks the rights of people, she wants to speak out more about rights and the fact that at the moment they are so meaningless, right? So the big issue there. The second big issue I'd just like to put is what I would describe as we've got real concerns about integration. If we have one criticism of the NHS when it was set up, right, it wasn't democratic, right? They decided to take it away from local authorities and so on, put it there separately. And I think that's now in some ways coming home to roost, because there's nobody to defend the NHS now it's being cut. So we've seen complete collapse of certain services. I mean, I don't know, your dentistry is almost like public dentistry is completely gone. There's no one to defend it, right? Because it's all top-down management and so on, right? Managers take decisions. They're not accountable to anyone apart from the minister. So things badly go wrong. So we think, and we accept, right, local authorities have done terrible things, but we need to reinvigorate local democracy. It doesn't mean leaving just things to councillors. We would like to see a national care service where all the services were democratically controlled. So that means that people who use services, unpaid carers and so on, the workforce would all have a say, right, on how those services would be like parent-teacher associations, but much, much stronger. So they actually had a say on how services were run, and that those services were embedded in local communities. So what that means is that people could go in, they have local services, not run by remote providers somewhere else, run from a local community where they could go and see the man. If there's a problem with the service, people could go and see the manager, sort things out. So we have a very different, I'm quite happy to say more about that. We would like to see a reinvigorated democracy about in terms of that. And the last thing, I'm just sorry, because I always talk too long, but I must, with Carmen here, I must say something about the workforce too, right? The workforce is absolutely crucial to make this happen. And I would say at the moment, as a social worker, the workforce has actually been brutalized, right? Social workers have been turned, from a social work perspective, social workers have been turned into gatekeepers. So all they do, their main job is to stop people getting a service. No wonder people hate them. I was trained to help people, right? Not to restrict resources and manage budgets, but that's what it's turned into. And of course, the other thing then social workers been turned into is protection, child and adult protection, which quite frankly hasn't worked at all. It's turned into a blame game. So social workers judge people for what they do rather than getting in and helping and supporting families, which is what I trained to do. But we've also got, much bigger than that is the care workforce. It is quite extraordinary, right, that we expect people to go and care for people, which is one of the most complex jobs in the world you can do without any training, basically, right, for absolutely shocking pay. And the thing that we would put down is complete lack of support. And that's both mutual support, so it's like spaces for workers to get together and talk after work, you know, share experiences, de-stress, learn from each other, do all that sort of thing, as well as support from management. So we've got a really terrible situation in the workforce. And what we think needs to happen is that workforce needs to be empowered. And if we had a far more empowered workforce without the top-down management, people could work with people needing care and take practical and sensible decisions, right, about how that care was delivered. So instead of a manager saying, oh, there's half an hour care needed a day, if you go in for 31 minutes, you're not going to get paid for that time, you know, and if you go in under one, and all of that stuff, and the terrible commissioning that has driven some of that. Instead of that, we would like to see like the frontline workforce being able to be empowered to take judgments about how they work with people, and that, you know, would be real co-production. I hope that's enough to get you going.
That was enthralling, Nick. Absolutely, thank you. And I'm so sorry there wasn't more people here to hear that. I'm just going to stop the recording just so that people can ask questions freely, if that's okay. So I'm just going to stop the recording.